The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Okay, now let's go to obstetrics and gynecology. 181. A parturient is said to have a positive contraction stress test when which of the following criteria is met. So this is a recall question. Ano ba ang contraction stress test? The correct answer is D. Positive contraction stress test kapag late fetal heart decelerations following greater than 50% of contractions, even if the contraction frequency is less than 3 in 10 minutes. So let's talk about contraction stress testing. What's the requirement? 3 contractions in 10 minutes. Pag positive siya, it's abnormal. Late fetal heart deceleration following more than or equal to 50% of contractions, even if the contraction frequency is less than 3 in 10 minutes. And a negative test result is actually normal, which means there is no late or variable decelerations. 182. A Gravida 2 Para 1 patient has been on the second stage of labor for 3 hours with the fetal head at station +5. Outlet forceps extraction was completed. Pudendal nerve block was performed. Which of the following serves as an identifiable landmark in performing pudendal nerve block? It's the ischial spine. This is an anatomy question actually because the pudendal nerve loops around the ischial spine. 183. Patient on her 37th week AOG had intrauterine fetal demise. Upon examination of the fetus, the length of the cord is 20 centimeters, maiksi. Which of the following is a consequence of this cord length? Remember, the normal length of the cord is 50 to 60 centimeters. So, yung dito sa case 20 lang, maikli yun. If the cord is too long, dahil mahaba, it's floating around there in the amniotic fluid, there's a high chance for prolapse, entanglement, and knots. Kapag too short naman, imagine mo, apakaikli nung attachment ng baby to the placenta and the nutrients from mommy. So, there's a likelihood for growth restriction. Okay. 184. Primigravid came in for prenatal consult. Based on a presumptive LMP, AOG was 41 weeks. Based on an early ultrasound with CRL compatible to 7 weeks, AOG is now at 37 weeks. Latest ultrasound showed AOG of 35 weeks. Which of these will you use for fetal aging? Answer is early ultrasound. Why? Let's look at the ACOG guidelines on estimating AOG. Ultrasound measurement of CRL up to 13 weeks and 6 days is the most accurate method to establish or confirm gestational age. The accuracy is ±5 to 7 days. When in doubt, early ultrasound, crown rump length. So let's go back to the case. In the case, ang LMP niya daw 41 weeks. If you calculated based on early ultrasound, 37 weeks naman daw. Kapag late ultrasound naman, 35 weeks. So there's a discrepancy of 28 days. So LMP 41 minus 37, that's actually 4 weeks. 28 days yung discrepancy ng early ultrasound versus dun sa LMP. So alin daw yung susundin mo? Based on this table, you should follow the early ultrasound. Okay? What is the appropriate management given the following BPS findings in a diabetic patient? 1 episode of fetal breathing, 3 discrete body movements, 1 discrete flexion and extension of the arms, AFV7 reactive NST. The correct answer is repeat test twice weekly. Let's look at the components of the BPS. There's the non-stress test, fetal breathing, fetal movement, fetal tone, and amniotic fluid volume. In the case, Reactive naman daw yung NST, so may 2 points na siya. Meron naman daw greater than 1 episode of breathing, so 2 points ulit. Meron din 3 discrete body or limb movements, so 2 points ulit. 1 episode of extremity extension and flexion, so 2 points ulit. And yung amniotic fluid niya, 7 cm, so 2 points ulit. This is actually normal. How do we know it's normal? Based on this table, kapag more than 8 ang score mo, usually normal yan. But wait, doktora, sabi mo normal. Pero bakit dun sa answer, repeat test twice weekly? Hindi ba okay na yan? Remember, this patient is diabetic. So even if the BPS is normal, we have to keep monitoring her twice weekly because this is a high-risk pregnancy. So remember, go back to the case, this is a diabetic patient with a high-risk pregnancy. Therefore, even if the BPS is normal, still we need to repeat the test twice weekly as per guidelines. Okay? Mnemonic for the BPS parameters: Batman, breathing, tone, movement, amniotic fluid volume, and NST. And score of 8, expedite delivery. So, 10 and 9, very high scores, normal. Pero pag 8 and below, you should expect mga aggressive management like delivery, expedite delivery. Amniocentesis is best performed during this period. The answer is 15 to 20 weeks. Bakit? Amniocentesis is still a high-risk procedure, no? So, you want to do it kapag medyo may maturity na yung baby. But you also don't want to do it too late because then it's useless. Right? Kasi what's the point of amniocentesis kung too late na into the gestation and you can't do anything about it? Okay. Let's go to 187, a 28-year-old G2P1 1001. Pregnancy uterine, 8 weeks gestation, came in with a transvaginal ultrasound result of a live fetus and a right ovarian cyst measuring 4x4 cms with benign features. Patient is asymptomatic. What is the most appropriate management? So, 8 weeks pa lang to apaka-early in the gestation, tas asymptomatic naman. May gagawin ka bang invasive procedure? No. You just repeat ultrasound after 2 to 4 weeks, which is expectant management. So if you notice the choices A, B, and D, resection, dilatation, and curettage, they're all very aggressive. But remember, this patient is pregnant. You don't want to endanger the fetus by doing something invasive. And also, this patient is asymptomatic. Bakit mo siya bibigyan ng invasive therapy kung asymptomatic naman siya and you can just monitor? And this is in line with the ACOG guidelines on adnexal masses in pregnancy. The recommended evaluation of pregnant patients with pelvic masses is similar to that of premenopausal women. And remember, most masses in pregnant women appear to have low risk of malignancy and acute complications. Therefore, expectant management can be considered. 188, 23-year-old primigravid at her 30th week AOG came in due to new onset hypertension with BP 140/90. No other signs and symptoms present. 24-hour urine albumin is at 5,000 milligrams. Other lab findings were within normal limits. What is the diagnosis? It's actually letter B, preeclampsia with non-severe features. Okay, let's look at this summary table of hypertensive diseases in pregnancy. Pag gestational hypertension, basically mataas lang yung BP mo. Kapag preeclampsia without severe features, meron ka ng proteinuria. Pag may severe features ka, mataas ang BP mo, tapos marami kang other symptoms like cerebral, renal, liver, pulmonary, and hematologic. Tapos meron ka pang possible proteinuria. So, the more symptoms you have, the more likely it is that it's severe. Let's have this mnemonic. Severe features will send you to your crypt. Cerebral, renal, impaired liver function, pulmonary edema, and thrombocytopenia. Crypt. 189. Upon delivery of the placenta, the midwife noted a bluish mass visible at the introitus, associated with profuse bleeding. Uterine fundus could not be palpated in the abdomen. How will you manage this patient? First, what's your diagnosis? Uterine prolapse. So how would you manage uterine prolapse? Literally, the uterus fell outside of the body into the vaginal canal. You just put it back. Very practical lang mga OB, no? Lumabas, ipasok mo ulit. Ganun lang kasimple. 190, 32-year-old gravida 3 para 22002 at her 32nd week AOG, consulted because her husband has varicella. She could not recall having varicella during childhood. What would you advise this patient? His answer is letter D. VSIG should be given within 96 hours of exposure. The other choices are wrong, and let's look at why. So first, let's differentiate between congenital varicella versus neonatal varicella. Congenital varicella, usually you get it when the mother is infected between 13 to 20 weeks. And it's really bad, you know, skin scarring, limb hypoplasia, chorioretinitis, and microcephaly. On the other hand, mas benign ang neonatal varicella because it's a maternal infection sa 3rd trimester na. It's usually asymptomatic, but affected children may have shingles later in life. Regardless, the treatment is the same. For neonates, you would want to give the VSIG or acyclovir on delivery. For the mother, you would want to give VSIG within 96 hours post-exposure. Pwede ring acyclovir. But Varivax, the live vaccine, is contraindicated. Okay? 191. 28-year-old nulligravid consulted because of thin, whitish-gray, homogeneous, malodorous vaginal discharge with no other associated symptoms. Which of the following describe this condition? 1. This is a sexually transmitted infection. 2. Gold standard is gram staining. Treatment is oral metronidazole and vaginal pH is less than 4.5. What's your diagnosis? Bacterial vaginosis, right? Which among those are true? Let's look at this slide. The correct answer is letter B, 2 and 3 only. So this is a sexually transmitted infection. False. It's actually not sexually transmitted. It is, though, sexually associated. And 2 is correct. Gold standard is gram staining. And 3 is correct. Treatment is oral metronidazole. 4 is false because vaginal pH is usually more than 4.5. Let's look at bacterial vaginosis, particularly Amsel's criteria. pH greater than 4.5, clue cells, discharge, fishy odor. And it may cause preterm deliveries. Treatment is metronidazole, 500 mg tab BID for 7 days. When does the corpus luteum usually regress? Remember, the corpus luteum is formed by the leftover follicles after the egg is released in ovulation. It will naturally regress a few days after ovulation. Let's look at the choices, no? Ayan, alam nyo na yung correct answer. But anyway, let's look at the choices. Letter A, 14 days after onset of menses. 14 days after onset of menses, teka, di ba ovulation yon? In which case, it's too early. Dahil kaka-ovulate mo lang, kaka-form mo lang din ng corpus luteum, therefore hindi pa siya magre-regress. Letter C, ganun din. 26 to 28 days after LH surge, it's also ovulation, therefore too early. Letter D, 12 days before ovulation. Teka, parang menses yun ha. In which case, it's too late. Non-existent na yung corpus luteum mo. Eh, ang tanong, when does it start to regress? And the correct answer is letter B. Let's look at this graphic showing the menstrual cycle. So as you can see, the ovarian cycle and uterine cycle happen simultaneously. While let me annotate, while the egg is growing, the endometrium is also thickening. Tapos pag ovulate mo, ready na yung endometrium mo. Ready na for implantation. And then, After that, the corpus luteum will secrete all these hormones that will maintain the endometrium. Pero kung walang fertilization, magsished yung endometrium. Therefore, menses na to. Okay? Let's continue. 193, 58 years old, G5P5, 5005, menopause for 8 years, consulted because of vaginal spotting. No other symptoms noted. TVS showed endometrium thickened at 0.8 cm. What is the next appropriate step? What's your differential diagnosis? Probably an endometrial pathology. If you suspect an endometrial pathology, always do an endometrial biopsy. Okay, let's talk about endometrial cancer. It usually presents with post or perimenopausal bleeding, diagnosed using endometrial biopsy. And there are two types, the endometrioid and the serous papillary. Type 1 is endometrioid, usually in a peri or postmenopausal woman, usually hyperplastic endometrium and low grade. Type 2 naman, serous papillary, usually in late postmenopausal woman, atrophic endometrium and usually high grade. So, mas malala yung type 2. Okay? 194. Patient was given Leuprolin as treatment for endometriosis. What is the basis for giving this drug? Remember, estrogen is secreted in response to pulsatile GnRH. Continuous GnRH will inhibit estrogen secretion. Therefore, the correct answer is letter D. Leuprolin is a GnRH agonist, consequently decreases estrogen secretion. Let's go to 195 on surgical staging procedure of an ovarian mass. There was noted to be a 3 cm metastatic lesion at the omentum. What is the stage of the ovarian carcinoma? Recall question ito. Answer is letter D, 3C. Okay, let's look at the staging, surgical staging of ovarian cancer. Let me annotate. Okay, stage 1, ovaries lang. Stage 2, may pelvis ka na. Stage 3, meron ka ng peritoneum and outside the pelvis. And then stage 4, distant metastasis. Pero, important din yung size and number of ovaries involved. Kapag A, 1 ovary lang. B, 2 ovaries. C, meron ng surgical spill. 2A, meron sa uterus. And 2B, meron pang other pelvic structures involved. 3A, microscopic. 3B, visible up to 2 cm. 3C, which is in the case kasi greater than 2 cm. Greater than 2 cm. 4A, meron kang effusion. And then 4B, may parenchymal mets ka. So, unfortunately guys, very rote memorization lang talaga to. Titigan nyo na lang bago mag-exam. But aside from that, you can generalize it into this mnemonic, no? Ovarian cancer surgical staging. Pag 1, nasa ovary lang. 2, pelvis. 3, outside pelvis. And 4, distant. So, kapit patalim, ito na lang tandaan nyo. Kasi, marami pang items. And hindi mo pwedeng i-dedicate lahat ng brain storage mo for this table. Kasi marami ka pang kailangan aralin. Okay? 196, 23-year-old nulligravid presented with cyclic pelvic pain of 2 years duration. She also complains of occasional dyschezia. On rectovaginal exam, the uterus is fixed and retroverted. What is the gold standard for diagnosing her condition? First, what's the condition? May dyschezia, cyclic pelvic pain. This is likely endometriosis. And what's the gold standard for diagnosing endometriosis? It's actually laparoscopy. Okay, let's discuss endometriosis. Symptoms include cyclic pelvic pain, infertility, pelvic heaviness, and dyschezia. On IE, you would find fixed retroverted uterus with scarring and tenderness posteriorly, and the gold standard for diagnosis is laparoscopy. Okay, 197. A 32-year-old newly gravid consulted with pap smear result of LSIL. HPV test was negative. What is the preferred management option in her case? Answer is repeat co-test after 12 months. This is based on this table. Una, titingnan mo yung age, 21 to 24 or greater than 24. In the case, around 32 years old na siya, diba? So, you would look in this column. Tapos, nakita daw na LSIL siya, pero HPV negative. So, may repeat co-test after 1 year. Pero say for example, binago natin yung case. LSIL siya, tapos HPV positive. Mag-colposcopy ka na. Colposcopy. In general, pag LSIL, you start to see people undergoing colposcopy depending on the HPV test. 198. A 60-year-old has been diagnosed with cervical cancer stage 3B. Which of the following is characteristic of a stage 3B lesion? Let's look at the choices. The correct answer is letter A. There is hydronephrosis. Why? Letter B kasi, lower vaginal involvement, 3A lang. Sa parametrial involvement naman, 2B lang. And the positive pelvic nodes, 3C. So, ang 3B lang dyan is hydronephrosis. So, if may i-memorize kayong staging sa OB, it would have to be cervical, pangalawa endometrial. So, make sure to look at this table. Stage 1, cancer confined to the cervix. Stage 2, beyond the cervix but not to pelvic wall or lower third of vagina. Stage 3, cancer extends to pelvic wall and or involves lower third of vagina and or causes hydronephrosis or non-functioning kidney. Stage 4, cancer extends beyond true pelvis or has involved mucosa of bladder or rectum. 199. A newly gravid unintentionally left a tampon inserted in her vagina for several days, developing toxic shock syndrome. What is the mortality rate of TSS? It's actually 2 to 8%. Recall question siya, guys. I'm sorry. 200. The mechanism of action of combined oral contraceptives are as follows. 1. LH surge and FSH are suppressed. 2. Interferes with GnRH release. 3. Increases phagocytosis reaction in the uterus. 4. Acts as a barrier for insemination. The correct answer is letter C, 1 and 2 only. Bakit? So, when you're taking OCPs, you're basically giving exogenous hormones. So, nagkakaroon ka ng estrogen, sometimes even progesterone, that will have a negative feedback on FSH, LH, and GnRH. Okay, that's it for OB.
So last two subjects, start tayo with pediatrics. Okay? So first question, which is a recommendation by the CNSP for a first febrile seizure. So only one is correct. That is LP. Lumbar puncture is performed in all patients below 18 months old. So all of these are wrong. And let's find out bakit. So in the latest CPG of the Child Neurology Society of the Philippines, so lumbar puncture should be performed in all patients below 18 months. So LP per se is not used to diagnose a febrile seizure. It's more important to rule out other alternative diagnoses, especially your meningitis. Okay? So all patients below 18, kailangan mong rule out meningitis. So you do CSF analysis. However, for those patients older than 18 months with a febrile seizure, you only do an LP if they have clinical findings of meningitis. Okay? That's the rest. The rest of the diagnostics are not routine. So blood studies, EEG, neuroimaging, they're not routine after a first time na simple febrile seizure. Okay? So if you receive the patient in the ER, tapos ongoing na, nagkakaroon sa ng seizures, so the drug of choice is your benzodiazepines given intravenously. So kahit nagko-convulsion yung bata, you try to insert a line. If hindi yan kaya, you can give it rectally. So, to reduce the risk of recurrence, hindi po recommended. So, not recommended na mag-continuous or parang drip kang anticonvulsant or intermittently magbibigay ka ng dose ng anticonvulsant. So, hindi siya recommended for a first-time simple febrile seizure. So, simple febrile seizures are one of the most common seizure disorders during childhood. So, they peak and onset at 14 to 18 months of age. So, they're characterized as generalized tonic-clonic. They last for less than 15 minutes only, and they do not recur in the first 24 hours. And there are no focal signs post-ictus, compared nan sa complex. Okay? So, simple febrile seizures do not have an increased risk of mortality, unlike your complex febrile seizures or other seizure syndromes. Okay? And they also do not have any problems in terms of scholastic and language or cognitive development. Okay? Sige, so next question. So, adolescent boy with 5 years na siyang may insulin-dependent DM. On workup, you note the latest HbA1c to be 14%. This implies na his glucose control is poor. Okay, so DM is still the most common endocrine metabolic disorder in childhood and adolescence. So it's a syndrome characterized mainly by hyperglycemia due to either a deficiency of insulin secretion that's commonly seen in your type 1 diabetics or insulin action. So there's a resistance, which is commonly seen in your type 2 diabetics. Pero pwede rin namang both. No? So because of the hyperglycemia and deficiency in your insulin, there's abnormal metabolism of your macronutrients, there's an increase in your counter-regulatory hormones, there's osmotic diuresis or glycosuria. All of these result in the metabolic abnormalities seen in DM. Okay? So like in adults, the monitoring is with, pag long-term, it's your glycosylated hemoglobin or your HbA1c. Kasi it's reliable to check for the average glycemic control in the past 2 to 3 months. Okay, it's also predictive of the risk of progression of diabetic complications, especially yung mga microvascular complications ng DM. So if better yung control, complications are less severe, they may be delayed in their appearance or avoided outright. Okay, so like in adults then, yung monitoring, parang 7% yung goal, that indicates good control. And if poor yung control, around 13 to 20% yung value natin. Sa case natin, di ba, it was 14%, di ba? Okay. Sige, so that was DM. So let's move on to the next question. So we have a baby girl, 4 years old, with a rounded face, so parang moon fascies, with a lump on her back. So parang dorso-cervical fat pad. She's also hypertensive. So all of those are consistent with what syndrome? Your Cushing's syndrome. Very good. So what lab abnormality is expected in Cushing's? That's your best answer here is serum cortisol level at night is high. Okay, so best answer usually kasi hinahanap sa words. So bakit? So Cushing's, so it's a syndrome when the etiology is due to abnormally high cortisol. No? So ito yung basic foundation niya. High glucocorticoids. So the etiology may be adrenal, pituitary, or pwede rin idiopathic or drug-induced, which is actually most common. So yung features niya, so yung, di ba elevated yung cortisol? So normally, there is a diurnal rhythm in cortisol. So it's elevated in the morning and declines during the night. Okay? So this diurnal rhythm is lost in Cushing's. So best answer, elevated yung serum cortisol at night. And here, pour over yung excess cortisol into the urine. So there's increased urinary excretion of these steroids. And because glucocorticoids are essential in macronutrient metabolism, this includes your glucose. So there is hyperglycemia. It can also be an answer, however, usually sa boards, diba? You choose the best answer. So there's nothing better than the definition itself of the condition. Okay? And then last, so cortisol, although it's a glucocorticoid, at very high doses, it may exhibit mineralocorticoid activity. So mineralocorticoid, diba, salt, sugar, sex, salt. So in terms of salt, it may result in salt retention and potassium excretion. So it may result in hypernatremia and hypokalemia. Okay? So other features of Cushing, so again, diba, generally, they're central obesity, rounded face, moon fascies, flushing, a buffalo hump or a dorsocervical fat pad. There's hirsutism. There's also impaired growth, osteoporosis. They're hypertensive. They're susceptible to infections. And there's thinning of the skin. Kaya may purplish striae sila on their abdomen. Okay? So those are some findings for Cushing's syndrome. Okay. Sige, next question. So, baby pa, no? Mga 14 months old, high-grade fever for 2 days. When the fever lies, the mother noted a rash. So, kailan ba yun nakikita na rash after defervescence? That's in your roseola infantum. Okay, so that is the correct answer. So, rash after defervescence is characteristic of your roseola infantum. So, your rosolia or exanthem subitum or your 6th disease. So, it is characterized by a prodrome of high-grade fever for around 3 to 5 days. The rash then appears after defervescence. So unlike other viral exanthems, which usually the rash appears at the peak of the fever, here the rash appears within 12 to 24 hours of fever resolution. And peculiar sa kanya is it starts trunk first, diba? So sa gitna muna siya and then it spreads towards the neck, face, and extremities. So very common siya sa mga babies, no? Very common siya sa mga babies, mga infants 6 to 15 months old. And there's also a risk of febrile seizures with HHV6, okay? So just to compare the viral exanthem, so measles, keyword sa kanya, 3 C's, no? Coryza, conjunctivitis, cough, and cough-lick spots. Ito yung pathognomonic sign niya. And the rash occurs again at the height of the fever and proceeds cephalocaudal. So from the below or just at the hairline, kakalat siya pababa. And once the rash reaches the feet, there's desquamation and the fever lyses. So rubella naman or your German measles is a 3-day fever only. Again, it's also cephalocaudal in progression. Pero unique sa kanya is that there is prominent auricular or cervical lymphadenopathy. Okay? And discuss na natin yung roseola kanina. So other viral exanthems na pwede i-confuse is your erythema infectiosum. So characteristics sa kanya, dalawa. So your slap cheek appearance sa wrist, sa face natin, and a lacy reticular rash sa trunk. So slap cheek, lacy reticular rash, yung mga keywords for parvo B19 causing erythema infectiosum. Okay, and a plastic crisis, kasi it was mentioned in sa microbio earlier, erythroid progenitors yung kanyang target. So sa varicella naman or chickenpox, yung keyword sa kanya is multiple stages of development yung mga lesions niya. So merong vesicles, may rash, may ulcers or ulceration, may nagka-cross na, may nagka-scab na. Or yung another characteristic sa kanya is yung dewdrop on a rose petal. And also appears first on the trunk, just like roseola. Okay? Sige. So, very high yield din yung mga viral exanthems. So, kindly familiarize yourself with those. Okay? Kasi maraming pwedeng itanong. Next, which is false about hand, foot, and mouth disease. Correct answer here is vesicles resolve in about 14 days. Kasi vesicles resolve in around 1 week. So, hand, foot, and mouth disease caused by Coxsackie A16 virus mostly and also enterovirus A71. But other Coxsackie and echoviruses and other enteroviruses may cause this disease also. So, the findings of the disease is in the name itself. So, hand and foot and mouth. Okay? So, hand and foot, they're tender, macules, papules, vesicles, pustules, or even ulcerations in the hands, fingers, feet, buttocks, and groin. Sa mouth naman, there's inflammation, vesicles, and these vesicles may erode or ulcerate. So, parang masakit yung bunganga, kamay, at saka paa. And these lesions usually resolve in about 1 week only. Okay? Not 14 days. Okay, and there may be other rarer manifestations. Okay? Sige. Next question, 6th question. So, post-exposure prophylaxis to someone exposed to varicella. The correct answer is letter A. So, the active vaccine or the live vaccine may be given within 3 to 5 days of exposure. Okay? So, yung passive vaccine naman, it may only be given within 96 hours. And again, remember, the varicella vaccine is a live vaccine. Therefore, it has contraindications to the pregnant and those with immunocompromised state. Okay? Sige. So, Their varicella post-exposure prophylaxis may be given to households, playmates, and hospital workers. So you can either give the passive, the IG itself, or the active live varicella vaccine. So as mentioned, yung live vaccine, we give it within 3 to 5 days. However, it's contraindicated in the pregnant and immunocompromised. Yeah, there's an option for these people with contraindications to give the passive or the antibody itself, VZIG, within 96 hours of exposure. So 96 hours, mga ilan yun? Mga 4 days. Ito naman, 3 to 5 days. Okay, it's recommended for pregnant, the immunocompromised, and newborns to mothers who had maternal varicella. Okay? Sige. So remember ha, live vaccine po yung varicella vaccine. So next, 10-year-old boy with prolonged fever, may headache, may abdominal pain, flushed skin, may thrombocytopenia. Kasi ano yung cutoff nan? That's 150,000 platelets, di ba? So that's very characteristic of your dengue with warning signs. Okay? So yung dengue, it can be classified into 3. So dengue fever only without warning signs, dengue with warning signs, and severe dengue. So sa dengue fever, so there's an endemic area. So usually naman almost entire of the Philippines endemic naman sa dengue. And the fever is prolonged, no? Mga 2 to 7 days. And here are the other clinical findings. So, di ba? Breakback fever, yun din yung tawag sa dengue. So, masakit yung likod, masakit yung mata, may headache, positive tourniquet test. Those are all consistent with dengue fever. So, the warning signs, I think this has been one of the best mnemonics I've seen for the warning signs of dengue. This was from one of my blockmates in UP Med, Dr. Villacorta. So, Lala Move PH. So, lethargy, abdominal pain or tenderness, liver enlargement, anuria, mucosal bleeds, oliguria, persistent vomiting is the keyword there, edema, so platelet decrease or your thrombocytopenia, and hemoconcentration or your elevated hemoglobin. Okay? Tapos your severe dengue, tatlong severe, no? Severe plasma leakage, severe bleeds, or other severe organ involvements. So that is your dengue spectrum. Okay? Sige. So next question. So acute onset watery diarrhea and vomiting, naging dehydrated. So dehydration is the worst complication of diarrhea and vomiting. So the first step of management will be to provide your volume replacement para itong deficit therapy or your resuscitation for the patient. Kasi severely dehydrated na siya. Okay? So total fluid requirements, so tatlo yung kailangan tandaan. That's maintenance, ongoing losses, and volume replacement of your deficits. So maintenance, it's your usual na sensible and insensible losses. So most famous na way to solve that is your holiday cigar method. So first 10 kilograms give 100 ml per kilogram. The next 10 is 50, and for every kilogram above 20 kilograms, you give 20 ml per kilogram. That's in a total of 24 hours. So you divide mo lang by 24, yun ang hourly rate. So ongoing losses, so ongoing, so bawat pagsuka or bawat pagpoops ng baby, you replace it volume per volume. Okay? And lastly, yung fluid deficits are for the children who are already clinically dehydrated. So in deficits, these are the fluids lost prior to medical care. So we give fluids depending on the degree of dehydration. So if it's mild, moderate, or severe. Okay? So in the steps in IV management of your dehydration, so you assess the degree of dehydration based on the clinical parameters or body weight if it's available. And if the patient is severely dehydrated, again, you give your resuscitation or deficit therapy. And if mild to moderate naman, you replace your maintenance and your ongoing losses. Your maintenance and remaining deficit, kasi may limit kasi yung initial resuscitation mo, and then replace ongoing fluid losses last when the patient is already stabilized. Okay? So, again, remember nyo yung tatlong categories or parang fluid requirements for patients with dehydration. Okay? Sige. Question number 9. When does periungual discombination occur in Kawasaki? So, discombination does in fact occur in Kawasaki, and it's usually in the subacute stage, which is 1 to 2 weeks after onset of the illness. So Kawasaki, or chronic mucocutaneous lymph node syndrome, is a medium-sized vasculitis, especially of the coronary arteries. patient population usually affected? Males in the first 5 years of their life. So the mnemonic is crash and burn. So start with burn. So there's a prolonged fever, no, at least 5 days yung fever sa Kawasaki. And then the mnemonic crash denotes conjunctivitis, usually bilateral bulbar, mapula lang pero walang exudates. Any form of rash except vascular and pustular. Cervical limb adenopathy, a strawberry tongue. So ito na yung enanthem mo. So ito parang, this is an exanthem. And ito enanthem. Kasi sa or yung mucosa natin yung involved. And then hand changes, which includes desquamation. So there are 3 phases of Kawasaki. The acute phase, ito yung fever plus most of crash. And the subacute phase. So this is very important na phase sa Kawasaki. So bakit? So it usually occurs after the 1 to 3 weeks. And here you see periungual desquamation. And more importantly, development of your coronary aneurysms. Which is why, at this stage, patients are the highest risk for sudden death. And then chronic, so parang nag-a-abate na lang yung inflammation. Okay? So the subacute phase is the most delicadong phase for patients with Kawasaki. And drug of choice is usually your IVIG. Okay? Next. So 9-year-old girl, keywords, honey-crusted lesions on the face and extremities. That's your impetigo. So impetigo is a very common skin infection, especially in children, in mga child daycares, mga ganun. So etiologies is either staph aureus, it's especially seen in bullous impetigo, or group A step, which is usually seen in non-bullous impetigo. So in non-bullous variant, it's what was described in the question. So discrete lesions surrounded by redness and a thick confluent or amber or honey-colored crusting. So non-bullous is usually in traumatized skin. So traumatized, may sugat na, which result in secondary impetiginization. So traumatized skin usually yung bullous, yung non-bullous. Sa bullous naman, these are usually seen in infants, no? Sa mga babies, neonates, and infants. And it's usually seen in untraumatized skin of the buttocks, face, trunk, and perineum. Okay? So non-bullous impetigo pa rin yung most common. Next, number 211. So baby, no, 15 months old. Keywords, DOB, barking cough, low-grade fever, stridor, respiratory distress. What's that condition? That's your croup or laryngotracheobronchitis. And the most common etiology of that is your para-influenza virus. Okay? So again, croup, nasabi na natin yung lahat. So parang low-grade fever, URT muna, tapos dahan-dahang lalala after 1 to 3 days. So there's hoarseness, a barking cough, and stridor. On X-ray, the classic or keyword or buzzword finding is your stipple sign due to subglottic narrowing. So yung management is for all levels of group, for all severities, you give dexamethasone, and if malala, you give O2 supplementation and nebulized epinephrine. If in respiratory failure already, you do intubation. Okay? So differences, so again, nasabi na natin yung croup. So barking cough, seal-like cough. Sa epiglottitis naman, older yung patient population and they're more toxic looking. Tapos mas mabilis yung progression ng respiratory distress. So toxic sila, there's a muffled voice, keyword din yan. There's drooling, the neck is hyperextended to open up the airway, and the patients are in tripod position to also facilitate breathing. So X-ray finding here is your thumbprint or leaf sign. Okay? And you want to do early intubation to secure the airway. Lastly is tracheitis. So parang there's copious, purulent sputum, and brassy cough. And patchy infiltrates or ragged tracheal column naman yung X-ray findings. And you give antibiotics. Okay? So yun yung differences ng 3 na nagrepresent ng airway obstruction sa mga bata. Sige. Next, so yeah, baby, 4-month-old infant, male, non-bilous vomitus after feeding, firm, movable, olive-shaped mass. Dagdagan pa natin para lahat na ng keyword in the upper abdomen. All of those points to pyloric stenosis. Okay? So again, the character of the vomitus postprandial, so after kumain, isusuka lang agad ni baby. It's non-bilous kasi it's before the duodenum. Bakit? Kasi diba yung duodenum, that's where, D2 specifically, that's where the biliary tree and the pancreas drops their secretions. So anything before that, non-bilous yung character ng vomitus. There's also abdominal distension, and again, a very important buzzword, a palpable olive-shaped mass in the upper abdomen. So UTS is confirmatory, and sa barium studies, you also see the shoulder sign. So there's a bulge of the pyloric muscle into the antrum, and the double tract sign. Okay? Yun yung mga keywords din yan. And then, definitive management is pyloromyotomy. So here are other keywords. So duodenal atresia. This time naman, it's bilous kasi duodenum na yung affected. And another keyword is the double bubble sign. So sa volvulus naman, it's failure to pass an NGT and your coffee bean or your omega sign. Yung malrotation, so parang iba-iba yung location ng structure sa loob ng abdominal cavity. So there's no cecum in the right lower quadrant. Buzzword management is your detorsion or your land procedure. Intussusception, so characteristic niyan, severely in pain si baby, pero paroxysms lang yan. So in between those paroxysms of severe pain, okay siya. Parang walang nangyari kay baby. Another buzzword is your current jelly stools. Okay? And then diagnostics are your donut or target sign and your cold springs sign. And Hirschsprung, so there's delay or failure to pass meconium, chronically constipated sila if less severe yung kanilang Hirschsprung, and there's explosive diarrhea on DRE. And the golden standard diagnostic is your rectal suction biopsy. Okay? Sige, let's proceed. So which of the following has a developmental red flag? That's your letter D. 12-month-old who cannot roll over. So masyado nang matagal na wala siyang head control. Okay? So again, I remember that this is a table that I got from your handout, no, ng mga developmental milestones. However, remember na these are just your average ages of attainment. So range naman, di ba, yung mga bata naman, hindi dekahon na gantong age ma-achieve nila yan. Each child, iba-iba, earlier or later nila yan ma-achieve. However, there's a limit, no? There's a limit to until what age they can achieve it. Okay? So yung walking, so usually, diba, 12 months yung walking. Pero however, up to 18 months pa naman acceptable na hindi nakakalakad si baby. Okay? However, kailangan talaga may head control na sila early pa. So 12 months na si baby na walang head control, that's really a developmental red flag. Kaya D is the best answer. Okay? So yung babbling naman, up to 8 months pa, pwedeng makakuha ni baby. Okay? Next. So, young naman ulit, no? Young, 18 months old, anemic siya, may painless passage of, may parang GI bleed siya. So, what diagnostic test is used? So, again, may GI bleed sa young patient. That's your mecal diverticulum siguro. And the best diagnostic is your mecal scan. Okay? So, mecal diverticulum is incomplete obliteration of your vitelline duct. So, remember your rule of twos. So, yung important here is that most of them present before the age of 2 years old. Okay? And then, aralin nyo na lang yung iba. And there are 2 types of heterotopic mucosa na present that may be gastric or pancreatic. So, yung mucosa na to, it's the reason why there is painless rectal bleeding. And if severe yung blood loss, may result in anemia. So, diagnostic with choice, nuclear medicine, is your TC99M per technetate scan. Okay? Or your mecal scan. Okay? Sige. So, last 6 questions. So, 4-month-old, okay naman yung weight, no? Increased episodes daw of regurgitation. Wala namang complications sa birth and maternal history. And hindi naman siya dehydrated. So, hindi naman siya nag-lose ng weight. So, the next best step is to reassure lang the parents na this is just part of physiologic or developmental reflux or regurgitation. Okay? So, remember na sa children, they're also developing over time. No? So, hindi siya like sa adults na develop na sila pagkarating sa atin as medical practitioners. So, children develop. Okay? And part of that development is also in their GI tract. No? So, with physiologic or developmental regurgitation, there's a reflux through an incompetent or immature LES. So, it will still mature over time. And it's common in the first year of life. So, even though nag-regurgitate si baby, okay naman siya, happy naman siya, not in distress, hindi naka-aspirate. Tapos, pwedeng maging magugutom siya after regurgitation. So, magpapadede ulit or magpapakain. And importantly, because it's physiologic or developmental, the baby will eventually develop these functions. So they resolve in 80% by age 6 months and in 90% by age 12 months. So, si baby sa example natin, 4 months pa lang naman. So we can just reassure the patient, the parents, na this is still developmental or physiologic. However, if it's persistent or with complications, we consider as pathologic and we investigate accordingly. Okay? But for now, wala namang warning signs na it's pathologic and bata pa naman si baby, so we just monitor and reassurance. Okay? Sige. Next question. 2-year-old, keywords, continuous murmur, second left ICS, bounding peripheral pulses. So continuous murmur, that should ring a bell. That's your patent ductus arteriosus or your PDA. So your PDA, the clinical buzzword, again, a continuous, machinery-like, kung gusto mong kompletuin yung buzzwords natin, continuous machinery murmur up to the infraclavicular or even sometimes supraclavicular areas. There's also bounding peripheral pulses and a wide pulse pressure. Bakit? Kasi nagkakaroon ng runoff in the cardiac output. Kaya siya wide yung pulse pressure. Okay? Sa QA naman, coarctation of the aorta, hallmarks may either be differential cyanosis, pag infantile yung pattern, or differential BP. So, mas mataas yung BP sa upper extremities kaysa sa lower extremities. Or weak or delayed pulses in the lower extremities. Yun yung adult pattern naman. And other X-ray buzzwords are rib notching, inverted E sign, or a 3 sign. Okay? So next naman, pulmonic stenosis. It's a systolic ejection murmur kasi diba, it's a stenotic lesion. So systolic ejection murmur, second ICS, left parasternal border. Kasi diba, ano yung mnemonic natin sa auscultatory areas? All pray to Mary. So second ICS, right parasternal border, second ICS, left parasternal border. So 4th to 5th ICS, left parasternal border, and here the mitral valve is in the apex. Aortic regurg naman, it's a high-pitched and early diastolic. Kasi nag-regurgitate during the relaxation part of the heart. Okay? So there's also wide pulse pressure kasi may run-off ng cardiac output natin, and there's Corrigan's pulse. Okay? So those are some of the keywords for cardio findings. All right? Sige. Last few questions. So full term, 5-day-old breastfed, tapos may breastfeeding jaundice, which is expected, no? So the correct answer here is A, normal reticulocyte counts. So direct bilirubinemia is only seen in cholestatic conditions. So yung breastfeeding jaundice, hindi naman siya cholestasis. And here, indirect bilirubin should be elevated, okay? And hemoglobin should not be elevated, okay? So breastfeeding jaundice usually appears on the first week of life, and causes are inadequate breastfeeding and decreased caloric intake for the baby. So diagnostic findings, again, we should expect indirect hyperbilirubinemia. The Coombs test is negative kasi wala namang ABO or RH na incompatibility. And the hemoglobin should be normal or low, not high. And the reticulocyte counts are normal. So management nun is just to advise the mother to continue and increase their breastfeeding. So here's an approach to hyperbilirubinemia. Again, direct is your cholestatic pattern. So pwedeng sepsis, biliary atresia, neonatal hepatitis. Yun yung mga direct hyperbilirubinemia. It's always pathologic. Always pathologic yung direct hyperbilirubinemia. Coombs test positive. So pwedeng yun yung mga ABO or RH na incompatibility. If Coombs test negative but elevated yung hemoglobin, we see that in polycythemia vera, infants of diabetic mothers, small for gestational age, mga twin-to-twin transfusion syndromes, yun yung mga increased hemoglobin. So normal retics, so ito yung mga parang may hemorrhage, yung breastfeeding or breast milk jaundice, tsaka, so yung mga ganun. And then yung mga increased reticulocyte count, so there's ongoing hemolytic processes within the body. So you see that in mga G6PD, PK, spherocytosis, eleptocytosis, okay? So that's an elegant approach to hyperbilirubinemia. So last 3 questions. So painless intermittent gross hematuria preceded by an ORT is seen in your IgA nephropathy or your Berger's disease. So IgA nephropathy is your number 1 most common GN worldwide. So it's either a nephritic syndrome pag malala or gross hematuria within 1 week. No? So compared to acute post-strep GN, it's closer to the preceding infection. Kaya usually, another keyword for it is synpharyngitic. Okay? Unlike sa acute post-test GN, mga 1 to 2 or 3 to 6 weeks after an infection pa yun. So there's sudden onset, painless gross hematuria. And note also that there's normal C3 levels, unlike your acute post-rep GN na decreased din yung C3 levels. And there will be mesangial IgA deposits on immunofluorescence. Yun yung renal pathology findings natin. Okay? Last two questions. So 2-year-old girl, difficulty of breathing, cough, fever, takipnik. So those constellation of three findings should make you suspect pneumonia. Okay? Pick up in the children. Tapos there's also retractions, and O2 sats, mga 94%. Acceptable pa naman. But because there's retractions and very takipnik patient, that's already your pneumonia severe. Okay? So, again, clinical findings suggestive of your pneumonia. So, cough, fever, plus any of the following. So, grunting, retractions, O2 sats na decreased, nasal flaring, and takipnia, which will be your most sensitive. Kaya usually, ito yung triad ng children with pneumonia. Cough, fever, and takipnia. Okay, so there's also age-related cutoffs, no, ng takipnia. So, aralin nyo na lang to. So, remember na in children, iba-iba per age. Okay? And in the most recent guidelines, PCAP guidelines of the PAPP, they already changed the PCAP A to D na classification. Now, it's just low risk or non-severe CAP and high risk or severe CAP. Kasi management will change. Ito kasi i-outpatient, pwede pa. Ito kailangan na talagang i-admit. Okay? So there are clinical parameters and also lab or diagnostic parameters used in determining if a patient has non-severe or severe PCAP. So sa patient, severe siya kasi meron na tayong chest indrawing and retractions. And yung O2 sats, medyo malapit na rin. 94% yung cutoff. Okay? So, PCAP severe si patient sa previous case. Okay? Last question for PEDS. So, 33-year-old boy, ER, toxic looking, low-grade fever. So, low-grade, no? Pero toxic na siya with mild pharyngeal injection and keyword, tonsillar membrane formation. So, pseudomembranes in the pharynx and larynx are characteristic of your diphtheria. Okay? So diphtheria is one of your vaccine-preventable diseases. Etiology, Corynebacterium diphtheriae. Main mechanism of action is it's toxin-induced. So low-grade yung fever pero toxic si patient. And then malala yung sore throat such that there will eventually come a time that there's already membranous nasopharyngitis or tonsillopharyngitis. So it's non-exudative. Yun yung nagde-differentiate din sa kanya sa other bacterial infections. So wala masyadong exudates. So the pharynx is pula, injected, enlarged yung tonsils, and then the buzzword is your adherent gray pseudomembranes and your bull neck due to edema and cervical lymphadenopathy. Okay? So the characteristic adherent membranes, extension beyond the pharyngeal fosses, dysphagia, and a relative lack of fever. So low-grade yung fever differentiates diphtheria from other exudative pharyngitis. Okay, so that was your pediatrics. Thank you for listening. Okay, last stretch. So Prevmed na tayo for the last topic. Okay, so first question, which component in the epidemiologic triad focus on pathogenicity of a microbe? That's your agent, of course. So the epidemiologic triad involves three things: the agent, the host, and the environment. So the agent is anything that can initiate or perpetuate a disease process. Usually infectious yung context nito, no? But pwede rin namang other causes. Host naman is any individual or other living animal that affords subsistence or lodgement to the agent. And environment is the sum total of an organism's external surrounding conditions. And as you can see here, pathogenicity is one of the factors in the agent. And we'll discuss this in the next question. So, next. What's the term used as the ability of an agent to produce serious illness? Serious illness, so fatality, that's your virulence, okay? So, here are some terms specific to the agent. So, agent in terms of the environment, that's your viability. It's the ability of an agent to withstand adverse environmental influence. And the rest of these are the characteristic of the agent in relation to the host, okay? So infectivity is the ability to invade and multiply within a host or to produce infection. So pathogenicity is how that infection can induce disease which is clinically apparent. So virulence is a related term. It's the ability to produce serious illness and is measured in terms of their fatality. And then immunogenicity and antigenicity are related terms, which are related to the ability of an agent to induce immunity or stimulate host responses or interact with the products or effectors of the host immune response. Okay? So, most important siguro na terms are these three. Okay? Sige, next question tayo. Which letter represents the usual time of your diagnosis? Is that A, B, C, or D? Correct answer here is your letter D. Okay? So, bakit letter D? So, A is actually the period of your exposure. C naman is the period of your onset of symptoms. B are your pathologic changes. So A, B, C, D. And D is the time of your diagnosis. So let's analyze. So before any exposure, everyone is in the stage of susceptibility. So these are just your risk factors favoring occurrence of a disease. So once you have been exposed, up to the period of onset of symptoms, that's your stage of pre-symptomatic disease. So it's called incubation period if the agent is an infectious agent, and latency if it's non-infectious yung disease natin. So there is no manifestation of the disease yet, but pathogenic changes have started occurring, which is seen in letter B, no? So A is onset, B is pathologic changes, and C is the onset of symptoms. That's where there is the stage of clinical disease. So there's already recognizable signs and symptoms. However, hindi naman 'di ba na pagka-onset ng symptoms, a patient will immediately seek for help, no? So the time of diagnosis is after a brief period after the onset of symptoms. When the patient decides na, oh, I should see a doctor for this, okay? And the last stage is the stage of recovery, disability, or death. These are effects, no? Effects are outcomes after the disease, okay? Next, fourth question. Which of the following is not an indirect form of transmission or so pag hindi indirect, it means that it's direct. So which is a direct form of transmission? That's your droplet spread, okay? So your direct forms of transmission involves person-to-person contact, no? So it's either by a person who's symptomatic or carries the disease or a carrier only. So walang disease, pero pwede pa rin magkalat ng infection. So possible modes are direct physical contact, spread by respiratory droplets, fecal-oral transmission, sexual contact, bloodborne, or vertical transmission. So indirect transmission naman is something to a person. So vehicles to a person, pwedeng water, food, objects, fomites, vectors to a person, mga insects usually, and airborne such as dust and aerosolized droplets. Okay? So yun yung difference ng direct. So direct, sinabing mo direct, it's person to person. Okay? So next question. So pattern of occurrence when there's a sudden increase of cases from 1 to 2 na baseline naging 15 na. That's your epidemic. Okay? So let's discuss the occurrence of diseases in terms of their frequency. So absence of disease means wala, no? So walang recorded cases in the community, either from the start or the disease has been eradicated. So for example, yan is smallpox. So yung time and number na parang table or graph niyan is 0. So parang wala dapat. 0 yung dapat pag endemic, kapag absent of disease. Yung endemic and hyperendemic naman. So endemic is the habitual or usual or baseline occurrence of a disease within an area. So parang there is a persistent level na parang ganyan. And it's a special term called hyperendemic if it's persistently high level. So if ito yung habitual, it's hyperendemic. Pag persistently, mataas na mataas yung numbers. Parang ganun. Okay? An epidemic or an outbreak and a pandemic, parang I'll discuss din kasi medyo similar terms sila. So epidemic is an often sudden increase in the number of cases above what is normally expected or the baseline. So for example, if this is the endemic rate in the community, so parang if there's an epidemic, bigla siyang tataas. So parang ganyan. Outbreak naman is a term for an epidemic that is in a limited geographical area, whereas pandemic is if it's widespread na yung epidemic. So worldwide, many countries, many continents, buong world, basically, buong Earth. Okay? And sporadic, there's an irregular and infrequent disease occur. So parang, if this is the time over number, so parang pa-konti-konti, meron, tas wala, tas meron, tas wala, tas meron, tas wala. Pero konti lang sila. Hindi sila very, very increased, unlike an epidemic. Okay? So those are the differences. Next question. So what do you call this study? There's a randomization. There is an intervention deliberately given to a population, and we follow them up. That's an example of your experimental studies, no? So again, there's randomization, and its hallmark of an experimental study is that there's a direct or deliberate manipulation or intervention by the researchers. So usually this deliberate manipulation, you call that your independent variable. It's the stimulus that we as researchers manipulate, and the dependent variable is the responding behavior that we want to check or explain. Okay, so it's usually considered as one of the best evidences for testing causality and for testing any hypothesis. Okay, so to reduce bias, we either employ randomization or blinding of the patients. Okay, so next, so what type of study design is this? And so this is a two-step question. So what you need to assess, what's the type of study design, and then from the study design, what's the best statistic to use? Okay, so here you you selected based on exposure first, and then you follow them up for 25 years to check for the outcome. So exposure here is smokers to check for development of your myomas. So exposure, follow them up to outcome. That's an example of your cohort study. Very good, cohort study. And the best inferential statistic to use in a cohort study is your relative risk. Okay, so again, for cohort studies, first we start with the risk factor or exposure. We divide the population into those with the exposure and without the exposure, and then we follow them up over time. So there's it's prospective follow up over time to look out for the outcome. And the data obtained is either a relative risk or risk ratio and incidence. Kasi from people without the disease, we check for people who got the disease. So incidence is also another data that we can get from cohort studies. Okay? So in contrast, no, to cohort, no, na-explain natin yung cohort. So case control naman, we start from the outcome first. So we divide the population into cases versus non-cases, with disease, without disease, and then we track back retrospectively to check for prior risk factors or exposures. And odds ratio naman yung makakuha natin. For cross-sectional, it's a snapshot of time. So at one particular point in time, we get both the frequency of the disease and the risk factors of the population. Okay, we can only get disease prevalence in a cross-sectional study. Okay, very good. Next, what is the denominator for infant mortality rate? That's the C, number of live births in 1 year. So the IMR, the numerator is the deaths of all children under 1 year of age, and the denominator is the number of live births. It's the most sensitive index of assessing health status in the community. Bakit? So children, especially those under 5 years, how much more na under 1 year, are part of the vulnerable population in the community. So high IMR implies that there's a low level of health standards. So low yung sanitation, low yung healthcare, low yung nutrition. Okay? So other vital statistics and ratios. So again, in my lecture, diba, I mentioned yung mga generalizations. So most common denominator sa mga vital statistics ratios natin are your mid-year population. The most common K factor is 1,000. And I'll focus na again on the IMR and the Swaroops index. The most sensitive index of health status is your IMR, whereas the Swaroops index is a sensitive indicator for the standard of healthcare. Okay, and developed countries have higher Swaroops index because people do not die young. Okay. Sige, let's proceed. Question number 9. So keywords, diba? Farmer from Samar, abdominal pain and fullness after a pruritic rash on the leg. All of those should point you to the diagnosis of schistosomiasis. Okay, schistosomiasis. So schisto is what type of water-related disease? It's a water-based disease. Okay, kasi it involves contact with water. So waterborne diseases, the transmission involves drinking contaminated drinking water. It may be microbial or non-microbial in etiology. So examples, typhoid, cholera, Hep A, dysentery, amoeba, Ascaris, and trichuris. Or non-microbial, pwede mga heavy metals or dental fluorosis. Water wash disease, as the name implies, hindi ka nakaka-wash, kaya ka nagkakaroon ng diseases na to. So there's inadequate water supply for one's sanitation and hygiene. Hindi ka nakakaligo. Examples, scabies, lice, hookworm, conjunctivitis, typhus. Okay? Water-based, as I mentioned, by contact with water. So schisto, di ba? Yung cercaria in the water, when they penetrate your skin, that's how you get schisto. Okay? And another example is lepto, so open wounds in pwedeng pumasok yung leptospires in flooded or contaminated waters. Okay? And last are the vector-borne. So vectors are insects that harbor the infectious agent, and their life cycle revolves around the water. So example, yan mga mosquito-borne diseases like dengue, Japanese enceph, chikungunya, and the like, and filariasis. Okay? Sige. Next question. So which of the 10 halamang gamot is not paired with its expected use? It's your ulasimang bato and lowers cholesterol. Kasi ulasimang bato lowers uric acid. Yung naglo-lower ng cholesterol is actually your bawang. So just read up on this table, familiarize it pag malapit na yung Prevmed exam. But I'd like to emphasize yung usually ginagamit natin sa mga clinics natin. Include na lang din natin yung bayabas. So lagundi, sambong. So lagundi is for cough, di ba? Cough, pag inubo yung pasyente, you can give lagundi. And sambong is very effective for urolithiasis. Yung bayabas naman, usually ginagamit din siya for wound washing. Okay? Sige. So, next question tayo, number 11. So, which of the following is not a direct contributor? So, who is an indirect contributor to PhilHealth? That's your senior citizen. Okay? So, direct contributors, there are 3 categories. So, those in the formal economy, so sila yung may mga kontrata talaga, and the premiums are shared by the employer and the employee. So, pwedeng sa government, sa private, sa business, and take note, pati house helpers and family drivers are part of the formal economy. Yung informal naman, so wala talaga silang fixed contract, kaya yung premiums nila, nagbabayad ay kanilang sarili. Okay? So, this includes the OFWs, the blue-collar jobs, self-earning professionals, and dual citizens, naturalized Filipinos, and foreigners residing in the Philippines. And lifetime members, at least 120 monthly contributions. Kailangan mong nabayaran. Okay? Tapos indirect, so indigent, so wala silang visible source of income or hindi sufficient yung income nila. And DSWD, yung nag-determine ng mga indigents. So other sponsored members, they may be sponsored by LGUs, other government agencies, NGOs, mga ganun. And lastly, the senior citizens. So senior citizens or aged 60 and above, not under any other membership categories. They are considered indirect contributors. Okay? So next 2 questions are related. So pertussis outbreak. So 200 yung residents and 8 got infected. What's the overall attack rate? So out of the total population at risk, 200, all over 8 yung primary cases. So your overall attack rate here is 8 over 200 times 100. The correct answer here is 4%. Okay? So let's differentiate overall attack rate from secondary attack rate. So with overall attack rate, it assesses the number of primary cases who acquired the disease from the source itself. So it measures infectivity in the outbreak. So number of primary cases over total population at risk. Whereas the secondary attack rate assesses the number of secondary cases from the contacts. So contacts are those who were exposed to the primary cases. And it measures contagiousness in the outbreak. So it's secondary cases all over total number of contacts. Okay? So in the previous example, so 8 over 200 times 100, you get 4%. So related to the next question, so after 2 weeks, so 10 residents living in the same household, so 10 were contacts. Actually, 10 got the cases. 10 got the cases all over the total number of contacts. So in the household, there were 36 total. However, included na dito yung 8 na nagkasakit na kanina. So hindi na sila part ng total contacts at risk kasi nagkasakit na nga sila. So That's 10 over 36 minus 8 times 100. So that's their secondary attack rate. So the value there is 36%. Okay, so again, just to emphasize, secondary attack rate is only for those secondary cases or those who had contact with the primary cases. Okay, so it's the secondary cases all over the total number of contacts. So 28 again yung value kasi 36 yung contacts pero 8 na dun ay yung primary cases, nagkasakit na before, so hindi sila included. Okay? So remember to subtract the primary cases from the total number of contacts. Okay? Next, so hydatid disease, E. granulosus. Humans are classified as what type of host for Echinococcus granulosus? That's your dead-end host. Okay? So with hydatid disease, remember na the definitive host which carries the sexual stage. So the definitive host is where the parasite reaches maturity and can reproduce sexually. So the definitive host in E. granulosus, what's that? E. granulosus, it's your dogs. So dogs yung definitive host. Yung intermediate host naman, they only harbor the parasite for a short transmission period and have some sort of developmental or sexual stage. So in hydatid disease, it's your sheep or cattle. That's your intermediate host. So humans are accidental intermediate hosts or dead-end hosts for E. granulosus. Bakit? Kasi it generally does not allow transmission to the definitive host. Kasi parang minsan ka na makita ng asong kumakain ng tao in real life. Okay? So humans are considered dead-end or incidental hosts. Okay? And I leave you to review the other definitions ng paratenic and reservoir hosts. Okay? Last 6 questions. So 5-year-old boy for chemotherapy diagnosed with ALL, no? So now undergoing chemotherapy. So now there's mobilization of resources. Nagsistart na tayo ng therapy. So what stage in the family illness trajectory? That's your stage 3. Okay? So stage 3 is the stage of major therapeutic efforts. So there's great mobilization of resources of the patient, the family, and which is facilitated by the MD. So there's assumption of responsibility of care, and as physicians, you have to always remember the family is a therapeutic ally. We try to be partners with them in the healthcare for our patient. And this is where usually may hospitalization and it's stressful kasi mag-iiba yung dynamics and a routine ng family. Okay? So the therapeutic plans are affected by the psychological state of the family, the patient, their preparedness, their resources, and others, lifestyle and social cultural factors. And again, remember, stage 3 is the most challenging and rewarding for the MD. Kasi natitreat mo na yung patient. Okay? Whereas stage 1, no, before the diagnosis, that's the stage that is most challenging for the patient. Okay? So again, this is stage 1 to 5, no? So stage 1 onset of illness until diagnosis. So si patient lang kasi alone, so it's the most difficult stage for them. And in the impact phase, doon na nalaman nila yung diagnosis and they adjust to that knowledge. And in stage 3, as mentioned earlier, so magti-treat na tayo. Stage 4, there's adjustment. And 5, to the permanency of the outcome already. Okay? Sige. Last 5 questions, no? So known alcoholic, alam nga niyo yung complications from chronic alcohol intake, pero resistant pa rin siya sa change, no? Sabi niya, ito lang kasi yung stress relief ko, baka mas lumala pa yung health ko pag nag-quit ako sa pag-iinom, no? So their patient is in the stage of pre-contemplation. So parang fake yung awareness niya kasi resistant pa rin siya to change, okay? So here is a trans-theoretical model of change. A patient goes through 6 stages, no? So pre-contemplation, they're not thinking about it. They're actively resisting change. So contemplation, nag-iisip na mag-change pero naghanap lang siya ng push, no? So naghanap siya ng support, nagbabalance siya ng pros and cons, and try na rin eventually. So preparations, nagme-make na siya ng concrete plans and getting ready to make the action. So here in the action, they're already learning to control the underside behavior. They're dealing with the barriers and making the change itself. So maintenance, they're maintaining the change already and trying to stay committed. And the end goal is termination of the undesired behavior. However, there will be a population of patients who will relapse. So babalik sila sa undesired behavior and they will abandon the idea of change. Okay? So it's also an upward spiral kasi they learn from each relapse. So after relapse, babalik sila sa pre-contemplation and they'll go through the rest of the stages again. Okay? Sige. Next is, so 40-year-old butcher takes weekly doxy as prophylaxis for lepto. Level of prevention is actually only primary prevention. So bakit? So here, again, primordial prevention, that's when you're dealing with broad health determinants and you want to minimize future hazards. So usually mga laws to, public policies, yun yung ating mga tinututukan sa primordial na level. And then primary, you're reducing personal exposure to risk factors, okay? And then secondary, there's already exposure or there's already the disease process, pero wala pa siyang symptoms. And then tertiary, there's already symptoms and you want to limit or prevent disabilities or complications. So si Butcher, hindi naman sinabi na may exposure siya sa leptospirosis, but you're reducing risk factors by giving prophylaxis. So it's a form of primary prevention. You're removing risk factors. Okay? Kasi wala pa naman sinabi na exposed siya sa lepto talaga. He only is high risk, no, based on his job. Pero wala pang outright instance na nagkaroon siya ng exposure. Okay? Sige. Last three questions. So what statistical test would you use to check for before and after? So di ba before and after, keyword yun for a paired or dependent sample, no? Paired or dependent. Tapos dalawa lang naman before and after. So that's a best statistic tool is a paired t-test. Okay? So here are two ways of obtaining two dependent samples. Again, easiest before and after, pre and post measurements, or you do a matched samples. So they're matched according to characteristics. So that way, paired t-test yung gagamitin. Okay? So here's a table listing down the various statistical tests to use. So when you want to assess the relationship of two qualitative categorical nominal variables, you use the chi-square test, di ba? Chi-square for categorical, di ba? Categorical tests. Again, from the same sample, so paired, but before and after or matched, you use the paired t-test. If two independent naman, you use your unpaired t-test. If three or more, basta two, di ba? T for two. T for two. Okay? Pag three or more, ANOVA, three syllables, ANOVA. Three or more variables. If you want to check the strength of association of two quantitative values, are they correlated? So will X and Y be correlated? That's your correlation tests. And if you want to predict the value of one quantitative variable from another quantitative variable, so what's the weight of a patient based on their given height? So you use a regression. Okay? So I hope that helps you decide in choosing the appropriate inferential statistical tool. All right. So last two questions. So here, from the population, you start getting samples from the eighth member. You randomly get it, and then every 10th student, every eighth student, you get them as part of your sample. That is a systematic sampling design. Okay, so here are the various types of probability sampling designs. No, so systematic. No, so you randomly select the first, and then subsequent samples are selected every kth element. So there is periodicity, parang ganun. So where k is equal to the total population size over the sample size intended. Okay. So yung example nito ng systematic. So example, here in this population, you need a sampling frame. Sampling frame, so ililista mo 1, 2, 3, hanggang 200 elements. So you randomly select the first element. So for example, third yung nakuha mo, and you want a population of 10. So 200 yung population all over 10 na sample size, you select every 20. So yun yung systematic sampling design natin. Okay? And last question, mean median mode of this data set. So you first have to just reorder this from highest to lowest, and then get the average, the middlemost, and the most frequent observation. And then this is the mean median mode that you get, 4.8, 4.5, and 4. Again, so first from the data set, you organize them into lowest to highest in terms of value. So the mean is just the average. Okay, just the average. The median is your middlemost. So in this data set of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10, no? However, sa 10, it's even, no? Even numbers. So you get the average of the two middlemost findings, which are 4 and 5. And then the mode is the most frequent. Okay? So the mean, median, and mode are your measures of central tendency. So central tendency, so ano yung gitna ng data set natin. So measures of dispersion, how far each value is from each other, no? So if it is heterogeneous, so parang malayo yung mga observations. But if it's homogeneous, magkakalapit yung mga observations. And location, so where they are in the data set. Yun yung mga percentile na ginagamit din natin sa top-notch. Okay?